Mashburn, and today we're going to talk about the spine. So let me get my PowerPoint set up. Hang on just a minute. Okay, so we're going to talk about the spine, the curvatures in the spine, and some things and how the spine changes over your lifespan. So let's first talk about why do we even have a spine. We know what our spine is, right? It's our backbone. It's that long column of vertebrae that make our backbone. Hopefully by this time you started to learn about the different vertebrae. You have some in your neck, some in your thoracic cavity, some in your lumbar area, and then what we call our tailbone. We're going to go over some of those specific parts of the spine and talk about how they've developed those curves. You should have talked about the bones, or we'll be talking about the bones in the lab part of this course. The reason we have a spine, number one, is protection. And what is it protecting? The spinal cord. The spinal cord runs right down the middle of the vertebral foramen of the vertebral column, so it's nice and protected. It's an attachment point. If you look back at the vertebra, if you've not seen that yet, the vertebra looks something like this. And they have these spinous processes that kind of come off, transverse processes, and a spinous process that come off of them. And these are places that muscles can attach so that you can twist and move your trunk. It allows for movement of the trunk. And it also allows you to absorb shock. So think about your spine looks something like that. You've got all these little vertebrae. And between each vertebra is a piece of cartilage called fibrocartilage, and we call those our discs. If you ever had a herniated disc or a ruptured disc, that's a little piece of cartilage between those discs that helps to shock absorb. Also, the curves of the back act like a spring. So if you're pounding, your spine will act like a big shock absorber, like a big spring to help cushion the impact of jumping up and down or movement, things like that. So let's kind of review the spine and the different bones you find in the spine. Again, in your bone lab, you'll actually look at each individual vertebra and be able to recognize the different parts of the vertebrae. But in general, you have 7 cervical vertebrae, or 7 vertebrae that are in your neck region. You have 12 thoracic vertebrae. You have 12 ribs, so these vertebrae all attached to a rib. So if you have a rib, you have a thoracic vertebrae attached to it. You have 5 lumbar vertebrae, and that is down in your lower back. You have a sacral area, and it's actually 5 fused vertebrae. So in a child, you might see the 5 individual ones, but it's going to fuse and make one as an adult. And in the coccyx, which is your quote-unquote tailbone, in the adult you have 1, but it's actually 4 fused vertebrae. So in the child, you might see 4. It fuses to become 1. So you have your cervical vertebrae, thoracic vertebrae, lumbar vertebrae, sacral vertebrae, and coccyx vertebrae. Now, hopefully these names are starting to be familiar to you. We've talked about region names, the cervical region, thoracic region, lumbar region. So hopefully this is some vocabulary that's carried over all the way from Unit 1 to make it a little bit easier to know where these vertebrae are. Now, I want you to notice there's a nice kind of curve to the spine, and we're going to talk about those curvatures. Isn't that cute? This is a newborn, and you'll notice in the newborn, they have this nice C-shaped spine. They don't have the spine that looks like us, or looks like this. It's this nice C-shaped spine. And in order to develop a spine, an adult spine, where we have this S-shaped curve instead of the C-shape, you have a C shape instead of an S shape. These are developmental curves. You have to do something to develop these curves. And just think about development of a child. What's one of the first things that they do? They raise their head. Well, as their head raises up, as they start to hold their head up and look around, the curvature of the spine, those muscles start to strengthen, they start to pull on the spine, and they start to develop that curve. The next thing that happens, so we've formed this curve here. The next thing that happens, think about a child. They sit up and then they start to walk. Well, when a child walks, you ever notice they kind of stick their gut out, their rear end kind of sticks out, they kind of waddle? Well, that starts to bend this area, and again, those muscles will develop and start to pull on the spine and develop those curves. So if you look at a spine and you think about it, there's basically 4 curves going on in the spine. You have your primary curves, which are the ones that you're born with. that C-shaped curve. So remember, the spine used to look like this, okay, this C-shaped curve. So let's make that bigger, all the way down to here. So the curve that still goes in a convex direction here and here, the part of that original C-shaped curve, are your primary curves. And to the developmental curves, the ones that develop after you start to move your head and start to walk, where you start having these convex curves, concave curves, here and here, are your secondary curves. So you basically have 4 curves in your spine. So as you develop, you go from a C-shaped spine to an S-shaped spine. Now, if everything goes well, your spine will have a nice S-shaped curve with no abnormalities. But sometimes there's an abnormality that goes along with the curve. And scoliosis is an example of that. Here we go, there's my picture. Scoliosis is an example of an abnormal side-to-side curve or abnormal lateral curve. So you can see here, this is a picture or x-ray, and this curve is definitely curving out laterally to the side. So this is a lateral curve called scoliosis. An abnormal curve in the thoracic region, here, is basically called like a downward, like a hump, a hunchback, like an older woman's kind of hunched over. That's called kyphosis. So this is an abnormal curve in the thoracic region. And then the last one is lordosis. My picture's going to load. Hang on. Being slow. There we go, lordosis. And this is an abnormal curvature in the lumbar region. And so this one is really common. You see this in someone that's got a beer belly. So think about it, you've got a lot of weight on the front of your abdomen, and so in order so you don't fall over, you tend to kind of stick your rear end out and kind of stick your stomach out to keep your balance. When else might you see lordosis? Pregnancy. In a pregnancy, you've got all that weight on the front, so you tend to arch your back to try to keep your center of gravity so you don't fall over when you're carrying the baby. Now, in pregnancy, that tends to resolve. You have the baby, you lose the weight, your spine tends to straighten out. If you are overweight and you're carrying a lot of belly fat on the front of your body, and you start to do this sway back a lot, then eventually these muscles and these bones are going to kind of start to compress a little bit. The muscles are going to pull on the bones and cause those vertebrae to compress. And a lot of times you're going to get arthritis, and it's actually going to start pinching on some of those nerves. So low back pain is a lot of times associated with lordosis. The easiest thing you can do is lose the weight and then strengthen those back muscles, straighten up your back, relieve this curve, and you should feel better. So the longer you have belly fat, the longer you kind of have a sway back of that lordosis, the more likely you are to have low back pain. The faster you lose that weight, the more you strengthen those back muscles, the less back pain you should have. Alright, so let's talk about some developmental aspects. That was kind of the spine. We're going to talk about a few more developmental lifespan changes that have to do with the skeletal system. One of the obvious things is the fetal skull. Hopefully you've looked at the lab. If you haven't, one of the things you learned about in lab are called the fontanelles. Basically, think about the cranium of the skull. I've got a skull here. At the cranium of the skull, which is where the brain is, inside here. And in the birth canal, that skull has got to come out of the birth canal during birth. And so what you have are these little openings, these little fontanelles or soft spots that are associated with the skull bone, so that the skull can kind of compress and come out the vaginal canal without damaging the brain. You'll notice that the infant skull has more bones than the adult skull. When you look at a fetal skull, there's actually 2 frontal bones, and so they haven't fused yet. So you have a few more bones in an infant skull than you do in an adult skull. When you look at a fetal skull or a child skull, You'll notice that the mandible and the frontal bones, the mandible is smaller than in an adult, so they have this huge cranium and these small facial bones, because you really are trying to get as much brain as you can in a developing fetus and child. You want to get as much brain as you can before you deliver. You don't need a lot of extra stuff going on here. And so after birth, and as the child develops, then the face starts to grow. And so that's really common. If you look at a child, they have this really big cranial cavity, kind of a small squishy face, and that's typical. And then they start to get in proportion as they grow. Remember, those fontanelles are just basically soft spots. Where basically you have unossified, which means what? There's no calcium there, hasn't hardened, membranes between those bones. And there's 4 of them. You have an anterior, a posterior, and a mastoid, and a sphenoid. And you'll see those in lab as we go along. Another thing I want you to remember is when you talk about the growth of the child, again, you have a huge cranium at birth. But when you're 9 months of age, this cranium is about half the size of an adult. The brain is growing rapidly at this point. And so if you've ever had a child or have a niece or nephew, and you notice somewhere around 9 months to a year, if you hold them up to you, their head is almost as big as yours. Okay? They have this huge cranium, lots of brain mass, they're trying to grow, still squishy face, but this big cranium. They kind of look like a bobblehead. And that's why it's so important as children develop to hold up their head, hold their neck for them as they're trying to learn how to do that, because their cranium is so big to try to hold that big old brain in there that you have to help them learn how to support their neck and hold their head so their head doesn't flop over. They do have a misshapen large head compared to adults. The mandible and the maxilla, the facial bones, they're going to be a little small. And you're also going to notice that their arms and their legs tend to grow at different rates. If you look in your book, there's actually a picture that's got a baby, and it's got a child, and it's got a teenager, and then it's got an adult. And it's a great picture to kind of show you how the cranium size changes, how the arms and the legs change, and how the torso changes. So kind of take a look at that and just see, we don't grow proportionally. Especially if you have a child, you probably notice this, if you have a child, you've watched them grow through adolescence. One day they walk in and you go, oh, what happened? I mean, it's almost like their jaw just kind of started to grow one day and you all of a sudden noticed it looks a little out of proportion, or they have these long gorilla arms. They just don't grow proportionally. One day it's like their chin's growing, the next day their arms are growing, their legs are really long, their torso's really short. But eventually when they finally hit their full growth height, they're going to be all in proportion and it all works out. So don't be surprised if one day your teenage son walks in and you go, ooh, wow, he's got this big jaw and long arms and long legs and short body. It all works out eventually. That's just part of the growing up process. So make sure you take a look at that picture in the book. It's kind of a neat picture. A few more things to talk about as you get older. I tell my traditional classes when I talk about lifespan changes at the end of most units, pretty much everything's going great until you reach about 30 or 40, and then you just fall apart. It doesn't really matter what organ system you're talking about, bones, muscles, cardiovascular, skin, it all just falls apart starting somewhere around 30 to 40. Somewhere around 30 to 40, your height actually starts to decrease. The bones, you start to, the discs in your back kind of start to compress and you actually lose height. Your blood calcium levels start to fall, the calcium in your bones start to fall, which causes your bones to become more brittle. You tend to have more osteoclasts than osteoblasts. Remember, osteoblasts build bone, osteoclasts reabsorb bone or break it down. So the more osteoclasts you have, the more osteoblasts, then more osteoclasts you have than osteoblasts, the more your bones will be broken down. Spongy bone starts to break down. Menopausal women, once they lose that protective effect of estrogen, when they're no longer making estrogen, their bones become more brittle. It's real common to have a hip fracture. Think about all the weight that your hips are holding up. These big hip bones, that's supporting most of your weight, and they become fragile and you tend to fall. One thing I tell my students, a lot of times you'll hear, my grandmother fell and broke her hip, and that happens a lot, but sometimes she broke her hip and fell. Sometimes it's just a simple stepping off of a step just the wrong way, or sitting the wrong way, or just there's so much weight on those hips, they just fracture on their own, causing the fall. So you really want to keep those bones healthy. And it's really common to start getting low back pain because those vertebrae are starting to break down, the discs are breaking down, and you're getting compression, and you're starting to pinch nerves and have pain like that. It's real common for your vertebrae to start to break as you get older. So you want to build that bone in your youth. Hopefully you've learned that by now, that you need to be drinking your milk and doing your exercise when you're in your teens and 20s, building up as much bone mass as you can so that you have more time for it to break down over your lifetime. And this is just a picture of normal bone versus osteoporotic bone. You can see it's basically holy bone, a little spongy looking, and it's not real dense. It's more likely to break. You'll do an osteoporosis case study as part of your coursework, and you'll learn more about osteoporosis as we go along. All right, well, that's all I'm going to talk about today. Just go back and look at your spine, know the different parts of the spine, the vertebrae that you find in those parts of the spine, how the curves develop, and then just some basic thoughts about how the cranium, the facial bones, arms and legs grow at different rates throughout the lifespan. All right, that's all I've got for you today. I'll see you later.